topic which we are going to cover in case history is history of presenting illness. This is usually followed after chief complaint, and I have seen many students, they will be writing the same lines which you have written in the chief complaint. That is, for example, chief complaint is the patient own words along with the duration you would have written in the chief complaint. The same 2 to 3 lines you would have been copied in the history of presenting illness. It is not like that. What you should write in the history of presenting illness? Explanation, that is the patient own words, it should be explained clearly. For example, if the patient complains of DKT, what are the questions you should ask to the particular patient? For example, how long, or first when you notice the DKT, and then what is the exact stimulus, how, whether the sensitivity or the pain, how it is getting stimulated, by taking any aggravator, by taking cold or hot foods, and what is the type of pain, whether it is a mild, moderate or a severe type of pain, or it is an acute type of pain or a chronic type of pain, that is for a longer duration, and what is the type of pain, that is pricking type of pain, because sometimes if it is a pulpitis condition, it will be a pricking type of pain, and if it is a throbbing type of pain, that is it will be occurring during any abscess condition, that is periodontal abscess or something like that, there will be a throbbing type of pain, and if it is like a neuralgic type of pain, it is called as lancinating type of pain. So these are the various type of pain. How the pain is, whether it is gradually or acutely, it is rapidly spreading, that is it's a radiating type of pain, or it is in the current place only, and then whether the pain is aggravating when you are going to lie down. These are the various questions you should ask when the patient complains of DK, MS or TED. And coming to the next one, the patient complains of malocclusion, that is malalignment. What are the questions you will be associated with? You will be asking the particular patient. Okay, so you will be asking, do you have any other habits which you have been following, like mouth breathing, tongue twisting, nail biting, something like that, thumb sucking. So these are the various habits whether the patient is having or not. You have to ask. Then also you have to ask the patient whether any of your family members, that is even the mother and father, will they have any malocclusion. It may be a hereditary one. So these are the questions you should ask the patient if the patient complains of malocclusion. And coming to the next one, if the patient complains of bleeding gums, what is the question? Whether the bleeding comes for how much or how long. How much means it's whether it is a profuse one or it is a mild bleeding is coming. That is the question you should be asking. And also bleeding, how long you are noticing the bleeding from gums, and whenever it is aggravated, like brushing or mastication. These are the questions you should ask when about the patient complains of bleeding from gums. Also, another important concept in public dentistry point of view, you should ask whether the patient is having associated symptoms like bad breath. Because bad breath, the patient may explain, yeah, I have some bad breath in my mouth, sir. This may be also a chief complaint also. So what is bad breath? Because the examiner will ask, what is bad breath, what is the other name, and how you are going to measure it. Bad breath is also called as oral malodor or halitosis. Okay. So halitosis, it is derived from a Latin word, that is osis. So osis means it's a putrefaction or a general pathological condition. Okay. So halitosis, how you are going to measure? There are various tests actually, like organoleptic test, actual sniffing, gas chromatography, Barnard test. The most commonly used is organoleptic test because it is easy as well as cost effective method. How you are going to see? You are going to ask the patient to inhale his air and then expel his air. Okay, and you should be there at a distance of 20 centimeters away from the patient, and there is a 5 scoring criteria, whether it is no or mild or moderate or severe form of putrefaction or a halitosis, bad disease. And what you are going to measure in the organoleptic test, and not even organoleptic test, also in various gas chromatography or Barnard test, what you are going to measure, that is volatile sulfur compounds or volatile aromatic compounds like methyl mercaptan or hydrogen sulfide. These are the volatile sulfur compounds or the aromatic compounds you are going to detect or test using this various halitosis measurement test. Okay, so this is also an associated symptoms with regard to bleeding from gums. So this comprises of history of presenting illness, that is the explanation from the chief complaint which the patient have explained in the patient own words. Coming to the next one, that is patient medical history. So usually you will be asking, what are the various past medical history, what are the medical terms or what are the medical symptoms or conditions you have been facing. Usually it starts with various systems with regard to central nervous system, endocrine system, cardiovascular system, respiratory system, gastrointestinal system, and finally genitourinary system. These are the various systems you have to comment in your paper. Don't simply write it as CNS CVS, just give an explanation in a full form. These are the various symptoms. If the patient is having any positive signs, for example, he may undergo any heart problem or something like that, or the patient may be having a diabetes condition, or they may be having a blood pressure condition. If it is a positive finding, first write it in the initially you write it as a positive finding, whether he is taking any medication for the particular ailment, and you have to mention, and how long or what is the duration for which he is taking medication for the particular ailment. So this covers the first point. And what is the second point you will be asking in the past medical history? That is, the patient is having any drug intake or any drug allergies. This is usual even when we are encountering a patient in our dental clinics. The first question we will be asking, you are suffering from any diabetes, BP or heart problem. Then what are the medications you are taking, or you have any drug allergies, or you have any peptic ulcer problems. These are the usual questions you will be asking to the patient, even in a clinical setup or in a hospital setup, for the examination point of view also. Okay, and the third question what you are going to ask is, any previous hospitalization or any blood transfusion have happened in the recent past. So these are the three criteria you should ask in the past medical history. First one is, what are the various systems from CNS till genitourinary tract, and the second one is drug intake or drug allergies, and the third one is any bleeding disorders, blood transfusion or previous hospitalization. This covers the past medical history. Okay, ma?
Next, the past dental history. In addition to chief complaint and history of presenting illness, it is necessary to elicit about the past dental history because it gives the description of previous dental treatment and his or her reaction to the dentist as well as treatment, so that we can get accurate idea regarding the importance of pursuing a good dental treatment and his or her attitude towards the oral health. Past dental history includes previous restorative, endodontic, orthodontic or oral surgical treatments, reason for loss of teeth, complications of dental treatment including pre and post extraction experiences, prosthetic and orthodontic experiences including radiation for facial and oral lesions. Coming to the family history, in the family history, health of his or her parents should be asked, number and age of siblings, then any family conditions like diabetes, hemophilia and other hereditary diseases. So it is important to know about the family history.
Usually we will be starting up with the habits, and in this video presentation I will be discussing only about the pernicious habits, that is tobacco usage as well as the alcohol usage. Coming to the tobacco usage, you have to put it in a box, that's a table column, with headings like type, duration and frequency. Coming to the type, based on whether it is a smoking form of tobacco or smokeless form of tobacco. Coming to the smoking form of tobacco, you know the various types. I am not going to be in detail, like bidi, cigarette, chutta, chillam, hookah, hookli. These are the various smoking form of tobacco. So this is the type. And the next one, duration and the frequency. Duration, for how many years they are using this tobacco usage. And frequency, what is the number of bidi or a cigarette they are using, or what is the frequency in which they are going to use. That is among the smoking form of tobacco. Coming to the smokeless form of tobacco. What are the various smokeless form of tobacco you know? That is pan masala, that is PAN. And the next one is PWAM. There is a slight difference and you have to know the spelling of this. Pan and pan masala. Then Maha, mystery, Hans and snuff, everything, I mean puri tobacco, everything is smokeless form of tobacco. And among which you can again type, duration and frequency, based on which actually you have to relate with the diagnosis as well as with the treatment plan, because tobacco cessation counseling should be given in the aetiotrophic phase in the treatment plan. You have to correlate with whether the patient is having this pernicious habit or not. And you should also note it down the alcohol content they are taking, what's the brand and what is the frequency and how much for the duration for years they are using alcohol habit. So why you have to ask about alcohol habit? Because they have a synergistic effect when they are consumed along with that of a tobacco usage. So this finish off with the tobacco usage, that is the pernicious habits. Coming to the next one, important one, that is diet. What is their diet score? So we will start up as what is their diet pattern. For PGs they will be asking what is the diet pattern, because only fish the patient is taking means it is called as pescatarian, and only they are taking a dairy products but not eggs, lacto-vegetarian or ovo-lacto-vegetarian. These are the various forms, and no dairy products or nothing animal products means they are called as vegan. So these are the various forms. Mostly in PG level they will be asking this question. And coming to the next one, that is the diet chart. You will be putting a diet chart with usually we will be starting up with the 24 hours diet chart. So what are the various food the patient has consumed for the last 24 hours, and you will be circling with a red pen only the sweet items which the patient has consumed. And usually in a PG level we will be asking that the entire diet score. So the formula is the diet score is equal to food score plus nutrient score minus sweet score. And the reference usually they will be asking is NIZEL and PAPAS. NIZEL, PAPAS, PAPAS, PAPAS. It was given in Nutrition in Clinical Dentistry. Nutrition in Clinical Dentistry in the year 1989. This is the reference by which the classification of diet score is given. Coming to the food score, usually the number of servings into the following one, like milk, meat, cereals and the others. So these are the various forms for which, for example, meat having a score of 12 into number of servings. For milk it is 8 into the number of servings, and the others and cereals will be having a score of 6. So with this you have to finalize with the food score. Coming to the nutrient score, there are totally 8 constituents in the nutrient score. For example, if you are going to write vitamin A, vitamin C, everything you should have a score of 7. You should write 7 in the right side of the constituent. And if the patient has consumed any of these 8 constituents, you will be rounding off with the 7. The maximum score which you can obtain is 7 into 8, that is 56. So this constitutes with that of a nutrient score, food score plus nutrient score. Finally coming to the sweet score. Usually with the formula food score plus nutrient score minus sweet score. Finally we are coming to the sweet score, because you are going to round with the red pen what are the sweet content the patient has consumed for the last 24 hours. Okay, coming to the sweet score, again you can see on my back side there will be a display what are the various sweets and what are they are classified. For example, the broad classification is liquid, solid and sticky, and slowly dissolving. For example, liquid will be having a number of servings into the score of 5. For solid and sticky, number of servings into the score of 10. Finally, slowly dissolving, like hard candies, everything, cough, breath mints, everything will be having a score of 15 into the number of servings. So this constitutes with the sweet score. And for the sweet score, you will be having a separate interpretation, like 5 is excellent, 10 is good, and 15 or more is watch out zone. This is the interpretation you will be giving for sweet score. Okay, so this completes with the sweet score interpretation. And the other cross question which you will be asked from the examiner is what are the various type of diet chart you know. That is, this we are taking a 24-hour diet chart. This is the most common one which we are following. And coming to the next one is, that is 3-day diet chart or 1 week, that is 7 days diet chart. So this constitutes the diet pattern or the diet history of the particular patient. Coming to the next one, that is source of drinking water. So this question is mainly to rule out any chance of fluorosis. If the patient is having any flow resistance, we have to know this particular point. Usually nowadays most of them are writing can water. Don't mention it as can water, write it as packaged drinking water. Otherwise borewell water or river water, whatever it is. Okay.